Hello, this is Faris AlHajri, PhD AM, Haqua Revitalize Therapy or Aqua Therapy. Do I proceed with my normal food intake, daily food intake, when I start implementing the Haqua Revitalize Therapy, hot aqua therapy or hot water therapy? And do I stop taking my medication, or I have to take medication with hot water? The first question, of course, we recommend to cut down your food intake as much as you can. By means, some people, depends on the volume of food that you take every day, but we have found that people need to cut down between 50 to 70% and sometimes on up to 90% of your food intake by volume, and substitute with the Haqua Revitalize Therapy or hot water therapy for the drinking method or the therapeutic methods of Haqua gulping, drinking hot water. Just in short, we have provided a session where why do we recommend to substitute the food intake with the hot water. Here, just in short, is that the hot water substitute the energy that the enzyme will depend to produce for the cells through the metabolic system. So hot water naturally and exclusively transport or shift the energy from the hot water that you take, you gulp, Haqua, gulping, according to the first law of thermodynamics, that the energy cannot be created, cannot be destroyed, but it's shifted from one body to another, from hot body to cold body. So the hot water that we recommend is at temperature of 50 degrees Celsius for adults, which is about 122 degrees Fahrenheit, and for children is 40 degrees Celsius. Well, children, we mean below 18 years old, from babies above, whatever the age, until age of maturity. The temperature of the water, the hot water that we recommend, is above the body's temperature. Human body's temperature is about 36.5 to 37 degrees Celsius. So naturally and exclusively, the energy shifted from the hot water to the body exclusively by hydration. So in this case, since energy is provided naturally, shifted to the cells without food metabolism, without leaving metabolic waste, that means that's a good news for you, because metabolic waste for us, as we have hypothesized, we realize that 90% of diseases result from the metabolic waste, because the body does not get rid of all the metabolic waste, and then resulting to infection of the cells through the presence of this. The longer this waste stay in the body, because the body does not get rid of all the metabolic waste by means of detoxification. So hot water, what does it do? It helps the body to detoxify, to get rid of the toxins in the body or from the metabolic waste, the harmful bacteria, the fat deposits. That's number one. Number two, it provides naturally energy to the cells without leaving any metabolic waste. That means without leaving any toxins to the body, simply because there's no any toxins in the water that we recommend for drinking. That is a potable water. We believe that we have answered question number one. So we recommend cut down your food intake. Forget about something called breakfast, lunch, or dinner. Just eat when you crave. Well, we call a cheating day. Cheating day means you cheat to yourself. So you have been doing this, cutting down the food intake, substitute with the program that we mentioned about the Haqua Revitalize Therapy or hot water therapy. But so what you do here, once in a week approximately, not more than that. Only in rare cases you can do it twice, but just once in a week, eat anything you feel you crave for. But make sure that you abide with the program that we recommended for adults and for children for drinking hot water per day. It means for adults about 3 liters per day. Of course, it depends on your activity and other issues, but that's a minimum we recommend for adults. For 3 liters of hot water spread all over the day with the temperature and method that we recommend. Question number two here, should I continue with my medication? That's completely out of our issue, because the physician, the doctor who prescribe you the medication, he's the one who can reduce your medication or stop you to take your medication. That's not in our profession, that's not in our line. We are here to provide the health benefits of hot water. What does it do to your body? What does hot water has to do with the biologic system of human being, with your health, with the overall system of the human body? But We need to emphasize here, we have our own report. When we started this Haqua therapy in 2007 in August, when the moment we discovered through the experiments in the kitchen using cold and hot water. From that time, as we were suffering from various chronic complications, low backache, migraine, recurrent attack of asthma, and allergic rhinitis. The moment we started the hot water therapy, since we were carrying these chronic diseases for quite many years, so we lost hope. We found that the medicine were not, they were solving the problem, but temporarily, because they are not solving the root cause of the disease, only the symptom. But due to the presence of the chemicals from the drugs we were taking, the medicine, then we started to have more complications. So what happened when we started the hot water therapy? Personally, we decided and we informed our physician that we cannot continue taking the medication, and we are on hot water therapy. Of course, he did not believe at that time, but later on, after 2 years, when he did a complete checkup, he found we are asymptomatic, and we received a certificate from the medical committee, and we have that one with the 63 medical checkup that has proven we are completely asymptomatic. Since that time, already 10 years, so we're talking from 2007 August, and now it's 2018 March, 10.5 years, we have achieved completely abiding with therapeutic methods of drinking hot water, or therapeutic methods of Haqua gulping daily. We abide, and we abide with other modalities of hot water therapy, Haqua Revitalize Therapy, on a daily basis. So already for 10 years, myself and my entire family and many people who follow these procedures, who follow this therapy, they have benefited. So that's the reason we cannot stop people taking medication. That's not in our profession, but it's up to the patient and the physician who has prescribed the medication to the patient. So we wish you a wonderful day and healthy life to all of you. Bye-bye.